Look closely at this face. It's the face of one of COVID-19's victims. It's a window into the story of who coronavirus is killing. Black people are dying at disproportionate rates in the United States.
I will miss my daughter for eternity. She was like a butterfly. She was just a great daughter.
Experts say the U.S. could have anticipated the deadly disparity.
Because we know that anytime a new disease enters the community, people of color tend to get the downside of that, and that's just not surprising at all. That was a recipe for disaster.
And some believe the solution to closing the gap isn't a return to normal, because normality is what produced the circumstances that left Black people more vulnerable.
I don't want to get past this pandemic, because the reality is that where we were wasn't really working for us.
Hey fam, I'm Imayan, and like some of you, I'm working from home during this pandemic. And today we're going to look at the social and economic factors that led to this acute crisis. It's a story about so much more than underlying health conditions.
Her last paycheck was $20.63. The $20.63 is what cost her. It was what took her life away. But I do know that she died helping humanity.
When grocery store worker Leilani Jordan finally made it to the hospital with severe coronavirus symptoms, her mother, Zenobia Shepherd, says she was already fighting for her life.
When she got to the emergency room, she fell out in the parking lot of Walter Reed, and they put her on a gurney and took her in. And immediately she had 104 fever, and they put her in isolation.
27-year-old Leilani entered the hospital on March 27th. She died April 1st, and even in her final moments, Zenobia says she had to push the chaplain to spend time with her daughter.
And I held her hands, and I sang to her, and I sang to her, and I sang to her. I touched her feet. I touched her hands. I touched her arms. I got in her ear, and I said, "Leilani, this is Mommy. I'm right here." Then she coded.
Leilani is one of the many Black Americans on whom the virus has exacted a particularly deadly toll. Around the U.S., early data shows Black people who contract the virus are dying more frequently than others.
The governor of Louisiana says more than 70% of their deaths have been African Americans.
Look at this chart. You can see African Americans represent 41% of COVID-19 deaths. The next closest race, Caucasian at 28%.
In Chicago, nearly 70% of virus-related fatalities are Black, even though African Americans make up less than a third of the population.
The numbers we're seeing aren't because Black people are getting infected more often. They're not, according to Dr. Anthony Fauci. There's something much deeper going on here.
Sometimes when you're in the middle of a crisis, like we are now with the coronavirus, it really does have ultimately shine a very bright light on some of the real weaknesses and foibles in our society.
The United States' long-standing racial health gap, which is fueled by inequality, is more than a foible. Let me show you.
Even though Black Americans are living longer than they have in the past, they are still more likely to die at early ages from all causes.
We know that there are reasons why we have these health inequities, and that's our societal issues, transportation and housing, and the environment, and all the things that we know that people of color have to deal with that are unequal. And by the way, that includes discrimination and racism.
Black people between 18 and 49 are twice as likely to die from heart disease than white people. And Black people from ages 35 to 64 are 50% more likely to have high blood pressure than their white counterparts. And then there's the fact young African Americans are living with diseases more common at older ages, things like stroke, diabetes, and high blood pressure.
For some of us, 45 is the new 60.
There are some familiar explanations for what's happening. Higher rates of diabetes.
African Americans have higher risk for a lot of these conditions across the board.
The hypertension, the obesity, the asthma, those are the kind of things that wind them up in the ICU and ultimately give them a higher death rate.
It's easy for people to understand talking about diabetes and heart disease, et cetera. And there's always this undercurrent that it's somehow your fault that you have that. Yes, having disproportionate health outcomes is important. It's not necessarily anybody's fault. The other thing we have to do is recognize that a lot of people of color work in public-facing jobs. That means while folks like me are able to stay at home, there are many people that can't.
When we filter the entire U.S. workforce by race, we find Black workers account for 13% of the labor force. It's comparable to their numbers in the nation's general population. And when we drill down to see what kinds of jobs people have, we learn people of color are more likely to be in roles deemed essential in this pandemic. Roles like the one Leilani Jordan had. Black and Hispanic workers are at the top of the list for work the government calls production, as well as the service industry, transportation, and material moving. These generally lower paid jobs likely don't have paid sick leave, health insurance, or retirement benefits. Black people also have higher unemployment numbers than any other group.
What I didn't include in those stats was the racial gap in median salary. You know, because the amount of money you make and have has a direct correlation to the type of healthcare you can receive. So this is why focusing solely on underlying health conditions to explain away why Black people are dying disproportionately of COVID-19 isn't enough. These fatalities are the result of larger systematic issues.
So what do solutions look like?
You know, the long-term solution, of course, is for us to put in place systems so that we end up with these terrible health inequities.
Dr. Benjamin says that closing the racial health gap means addressing structural inequalities in everything from incomes and housing to transportation and environmental health. It's exactly what David Johns is focused on, doing the work to make sure Black people aren't forgotten.
We're developing toolkits, we're hosting virtual sessions.
David says the nation's response to this crisis should heed lessons from another pandemic that caught the U.S. off guard, AIDS.
There are at least three connections between the HIV/AIDS epidemic and the COVID pandemic. And one of them, we're seeing a disproportionate impact upon the Black community. The second thing is with regard to stigma. And then the third way for us is really thinking about how in moments of crisis like this, it is organizations like NBJC and people that show up trying to fill gaps for the least of these that often get pushed to the back of the line.
The National Black Justice Coalition is only one of the groups helping with short-term relief.
What that looks like for us is contributing to families by providing grocery cards so that individuals who are not going to receive a stimulus check from the government or the CARES Act can otherwise cover the cost of groceries. We're also contributing to and helping people cover the cost of their rent.
But they and other activists also are battling the systematic issues that have brought the nation here. That includes fighting against paying rent during the crisis. Discussions about raising the minimum wage have fired up again as essential workers fight for better pay and conditions. And the implicit racial bias in healthcare is even more important as medical professionals face the difficult choice of who to treat during the pandemic. Treatment didn't save Leilani Jordan. Her death has resonated with her colleagues and community. Giant Food, the parent company that owns the grocery store where Leilani worked, says it's enacted new procedures, including installing temporary plexiglass shields for higher traffic areas, limiting the number of customers that can enter a store at any time, and recommending personal protective equipment for all employees. For Zenobia Shepard, the protections come too late.
They could have bought 2 boxes of gloves, which is 100 pairs of gloves in one box. Mask, they could have bought that too. Out of that one paycheck for $20.63.
As Leilani lay dying in her hospital bed, she gathered the energy to record one final video message to her mother and her family.
She said, I love you, I love my family, I love my dog, I love my job, I love my friends. She says, I'm going to miss you, Mommy. And she said, I won't be going back to Giant. This is the last time you'll ever talk to me again. Yep. She knew.